Today we will be talking about the cardiovascular system, anatomy of the cardiovascular system, blood, and various disorders. So we're going to start the blood. Blood volume is about 5 liters in an adult. I'm going to skip the circulation here. So it's a connective tissue. It has a matrix, liquid matrix, plasma, and formed elements which are red blood cells, white blood cells, and platelets, that all are derived from the hematopoietic cells in the bone marrow. Red blood cells carry the oxygen from the lungs to all the body tissues. Leukocytes participate in the immune defenses against infectious diseases, and thrombocytes or platelets are critical for blood clotting, which prevent the bleeding in case of the vascular damage. This is a micrograph of a typical blood smear. You can see red blood cells, you can see platelets, and you can see white blood cells. Obviously, the red blood cells are the most abundant. They are circular if you look at them like this, but from the side they will look something like that. So they have this invaginations, which increase the surface area and increase the rate of gas exchange. So we're going to talk about some disorders here. So Monica, that she changed the diets to reduce consumption, to eliminate the consumption of meat, and turns out that she has a very low number of red blood cells in her blood sample. So Monica, with her vegan diet of, as they say, cracker, popcorn, and noodles, she develops what is called a iron deficient anemia. She has low levels of iron, so nutritional supplementation of iron is an option if she doesn't want to start eating meat again. And she's pale because she has very low number of red blood cells, and therefore her blood is not as red as it should be. And iron is essential because iron is a key component of hemoglobin that transports oxygen in the blood in the red blood cells. It's part of a red blood cell. So it turns out that Malcolm, and Malcolm has bleeding gums. Okay, so it turns out that in Malcolm develops multiple bruises. He has bleeding gums if you read this through, and he is tired. So stuff like that, different aches. So here you can see massively enlarged white blood cells, abnormally shaped white blood cells. So he has leukemia. He's pale because white blood cells dominate in the blood and the number of red blood cells is low. And he bruises and bleeds easily because thrombocytes or platelets do not prevent bleeding, and this blood does not clot properly. So Andrew, if he inherited the blood disorder, you don't really need to read anything about it. Here you can see, here you can see sickle-shaped red blood cells. It's called sickle cell anemia. Treatment options: bone marrow transplant, hydroxyurea can be used. Another blood disorder that is caused by DNA mutation, it can be leukemia, it can be thalassemia. This is the heart, consists of 4 chambers, right and left atrium, right and left ventricles. Chambers are separated by valves, and great vessels, pulmonary trunk, and aorta are separated by valves from corresponding chambers as well. So we're going to talk about gross anatomy of the heart. We're going to identify atria. So this is the the right atrium, left atrium here, right ventricle and left ventricle. Valves. So tricuspid valve is right here, bicuspid is here. That's pulmonary valve here. This one is an aortic valve. Blood vessels, so superior vena cava and inferior vena cava is somewhere here. This is aorta and this is the pulmonary trunk. And interventricular septum is right here. It separates two ventricles. So A here, labeled A here, is left ventricle. So blood is pushed from left ventricle into aorta. B is right atrium. Right here you can see. And superior and inferior vena cava connected to the right atrium. Pulmonary trunk. Pulmonary trunk is labeled C because we know it is connected to the right ventricle. Heart valves. So the valve A, which is located between the right atrium and the right ventricle, is tricuspid valve, and valve B, which is located between the left atrium and left ventricle, is the mitral valve. Now here's the cardiac cycle. So heart is completely relaxed. It's called diastole, and blood basically flowing freely into right and left atrium, then into the ventricles. And then when atria start to contract, they push the rest of the blood into the ventricles. And then ventricles starts to contract as well, pushing the blood through the corresponding valves into the great vessel. So you have a full cardiac diastole, atrial systole, and ventricular systole. Now, we obviously cannot listen to our heartbeat, but you can try to do it, just putting your arm between your second and the fifth rib, slightly to the left from mediastinum, and you will be able to feel the heart beating. There are two sounds, lub and dub. So lub sound represents the closure of the atrioventricular valves, and dub sound, or mitral valve, and mitral and tricuspid. And dub sound represents the closure of aortic and pulmonary valves here. So heart rate, try to measure your heart rate when you're exercising and compare it to your resting heart rate. Usually the resting heart rate is about 70, and the cardiac auscultation and pulse rate determination heart rate, so basically when you measure your pulse and when you use stethoscope to listen to your heart, that's what auscultation is. Those heart rates are essentially the same. Now, try to check your heart rate after the exercise, or even if you have fitness watches during the exercise, and you will notice that it's higher than your resting. And the more intensive the exercise is, the higher your heart rate. So heart rate is altered by physical activity because you need to pump more blood to the tissues so they can perform functions and their functions in the new elevated level. So blood vessels, we have three major types of blood vessels. Arteries that carry the blood away from the heart. The largest artery is aorta. Carried towards capillaries that move the blood through the tissue. That's where exchange of nutrients and respiratory gases occurs. And then veins carry the blood from capillaries to the heart. Now this is the anatomy of the main blood vessels in the human: arteries and veins. We're going to label some of the structures here. So blood flow. From left ventricle, blood enters aorta. Then it goes into the renal artery. Renal artery branches further to the renal capillary beds. From renal capillary beds, blood is collected into the renal vein, and renal vein dumps the blood into the inferior vena cava, which dumps the blood into the right atrium. Now, the pulmonary circuit, the heart and pulmonary circuit. So from inferior vena cava and superior vena cava, blood enters right atrium. Then, through the tricuspid valve, it enters right ventricle. From right ventricle, through the pulmonary valve, blood enters pulmonary trunk. Pulmonary trunk delivers the blood. Here you can see pulmonary trunk. Delivers the blood in towards the lungs, where heart gets oxygenated, and then it arrives from the lungs into the left atrium. From left atrium through the mitral valve, it enters left ventricle. And left ventricle pumps the blood into the aorta via the aortic valve. So you've got your layup here. Not all arteries carry oxygenated blood, as you may have noticed. Pulmonary arteries actually carry deoxygenated blood towards the lungs, and pulmonary veins carry oxygenated blood from the lungs to the heart. This is a typical composition of blood vessels. Here you can see artery on the left with endothelium or tunica intima, thick layer of smooth muscle or tunica media, and the connective tissue on the outside, which is called tunica externa. In veins, endothelium, you can see the valve in the vein, which prevents the backflow of the blood. The layer of smooth muscle is much thinner, and connective tissue is a bit thinner too. Capillaries have only a layer of epithelial cells and a bit of a basement membrane on the outside. So this is the cross section of an artery and a vein. You can clearly see an artery with a thick smooth muscle layer and a vein which is flatter because it cannot kind of maintain its shape, and much thinner layer of smooth muscle. Now, measuring blood pressure will be impossible, but we will talk a little bit about the blood pressure interpretation. Okay, a few words about the hypertension, as we decided to say. So normal blood pressure is 120/80. Anywhere, say 40/90, it's pre-hypertension. Above that is stage 1. If you have 160/100, that's stage 2, that's dangerous. So first number reflects the systolic pressure during contraction, and second number reflects the diastolic pressure during relaxation. This is how we measure the blood pressure. We measure it in the brachial artery using sphygmomanometer. You can see it here on the right. Obviously, we cannot do the measurement of the blood pressure, but basically you pump the sphygmomanometer and then start to relieve the pressure, simultaneously listening to the pulse at the antecubital region, and appearance of cord cough sounds signals the systolic pressure, and disappearance of them signals the diastolic pressure. Disorders of cardiovascular system, intense headache on the side of the head, shrieking. Now let's take a look at the MRI. You can see the blocked blood vessel in the cerebrum, and that led to stroke. And if it's a blocked blood vessel, it's an ischemic stroke, not the hemorrhagic stroke. Treatment option: removal of the clot and rehabilitation. So chest pain, abnormal electrical activity of the heart, coronary angiography detected the blockage right here, the coronary artery. Cardiovascular disease is the myocardial infarction. Treatment option: removal of the clot as soon as possible. Rehabilitation. Stress may have played a role. Stress may increase thrombosis. may increase heart rate and therefore require for more blood supply, but if in response to stress coronary arteries constrict, then there's no blood supply to part of the heart, and it's a mismatch between the supply and demand. Sarah, she had odd bluish tint, so extremely low blood oxygen units. She had a septal defect in Sarah's heart, so left and right side of the heart had a, basically they were mixing together. You can see here the blood, the septal defect. So cardiovascular disorder is called a septal defect, and Sarah lips and nail beds display bluish tint because her blood was under oxygenated. Treatment option is a surgical repair of the septal defect. Now some review questions. Left ventricle, right atrium, aorta, and this is tricuspid valve on the diagram. Systolic and diastolic. Systolic blood pressure is the blood pressure during systole, during contraction of the heart, and diastolic during relaxation. In 125/75, diastolic is 75, the second one. Valves produce the sounds of heartbeat. Heart attacks are generally caused by the blockage of the coronary artery. Hypertension is the high blood pressure. Hypertension is the low blood pressure. Red blood cell, white blood cell, platelet. Red blood cell carries oxygen, white blood cell fights off infection, and the platelet is responsible for clotting. Blood disorders are characterized by emia. Cardiac auscultation is listening to the heart using stethoscope. Artery and vein. Atherosclerosis is accumulation of plaques in the cholesterol plaques in the blood vessels that decreases the vessel lumen, obstructs the blood flow, and may increase chances for strokes and heart attacks because if the plaque is being ruptured, it can be carried to the heart, to the coronary artery, or to the cerebral artery and block coronary artery, causing heart attack, or cerebral artery causing stroke.